Hello, and welcome to the show Beyond the Journal, where we discuss social media, digital education, and current controversies in cancer and medicine. I'm Dr. Jack West, Associate Clinical Professor in Medical Oncology at the City of Hope Cancer Center in the Los Angeles area, and I'm joined by my co-host, Dr. Charu Aggarwal, Leslie M. Heisler, Associate Professor of Lung Cancer Excellence at University of Pennsylvania's Abramson Cancer Center in Philadelphia. Hey, Charu.
Hi, Jack. And today we are pleased to welcome Dr. Shikha Jain, who's a GI oncologist at University of Illinois Cancer Center and founder of WIMS Summit. We are so pleased to have you, Shikha. Welcome.
Thank you so much for inviting me. I'm so excited to have this conversation with you both.
Great. So I think we would like to start off and, let our listeners know about you a little bit. So you've really carved a niche for yourself in terms of, I think, digital engagement, communication, while wearing your oncologist hat. So tell us about your role at your institution.
Yeah. So, I kind of forayed into the digital media space a couple of years ago when I started writing op-eds. And the institution I was at the time said, you're writing all these great op-eds, you should be putting it out there on Twitter. And I said, I don't have a Twitter account. I'm not 16. I don't know what you're talking about. I'm not going on Twitter. And they said, well, just try it out and just use it to put some of your research and some of your papers out there. And the first tweet I sent was actually, I was trying to tweet something out about my brother, who was very active on Twitter. And he called me 5 minutes later and said, what are you doing? You sent a tweet. The only person who saw it is me. And you don't know what you're doing. You're too old to be on Twitter. Get off of this platform. And so I told him, I said, I'm going to learn. My institution wants me to. So I kind of started doing a little bit more in the Twitter space and learning more about how I could use it for public health education and just keeping myself up to date, and then also disseminating my own research and then the research of my mentees and my colleagues. And so that's how I kind of started in the digital media space. Now at the University of Illinois, I've actually become the director of communication strategies for our cancer center and for the Department of Medicine. And also I am the associate director of digital innovation. So because of my engagement in the digital space on social media, they've realized, as many institutions have realized, that is actually a great place to engage with patients, to stay up to date, to educate, to mentor, to network. And so my institution now, the University of Illinois, has been wonderful at allowing me to continue the work that I've been doing for years and now utilize it in a way that actually helps our institution in a variety of ways. And then on top of that, I also do a lot of gender equity work. So utilizing social media and then also utilizing my networks and my equity research, I'm a part of the Division of Medicine Inclusion Council, where we do a lot of work on gender equity in the workplace and in the institution.
That's such a neat, unique role that you have as a communications strategist and really thinking about amplifying the voice, not just of your research, but of your mentees. So do you handle multiple Twitter accounts, or do you guide the content and creation and curation?
I do. So I think I have about 6 Twitter accounts that I'm currently managing in some way or another. And then I have 2 other Twitter accounts where I'm guiding students in how to put out tweets, how to most effectively disseminate information, how to screenshot something and tag people. So we do both the logistical and more practical tips, and then also the content tips. So kind of helping students and trainees learn how to better engage on social media, both by running accounts that are for organizations, and then also just through their own personal engagement. And I do quite a few lectures on utilizing social media as a healthcare worker and how to really maximize your impact and your benefit from engaging in those platforms.
So let's talk about some of the gender equity work that I think is not a profound statement, has gotten short shrift for a very long time, but is picking up speed. Maybe we can start with your impression of ASCO 2021 and some of what we learned and talked about that just happened. And, is this something that you think has really gained meaningful momentum? Are you gratified by that? Or do you still look at it as how much more there is still to do? So just overall impressions about that topic and the whole feel of it in recent days and before that.
So for people who know me personally, they know I am an eternal optimist. I think it's even on my Twitter bio that I am an eternal optimist. And then as an oncologist, I'm a cautious optimist, but there is some level of optimism in pretty much everything I do. I have to say that with ASCO especially, I have been incredibly impressed with how they have really made a point to incorporate equity into a lot of what they are trying to accomplish when it comes to scientific abstracts, when it comes to giving a voice to those people who really need it, when it comes to highlighting and showcasing these inequities that exist, and then coming up with strategies for how to really address them. I think that ASCO has done a really impressive job. I mean, just the fact that this year I was invited as a faculty discussant on an abstract that was presented on the parent gap and the gender trap. And the fact that 10 years ago, when I was, X number of years ago, when I was a trainee, I don't know if that was really highlighted as much in the scientific, especially in the scientific sessions. My husband overheard me recording my session for ASCO, and he said, "This is for ASCO?" So he's a physician, he's a gastroenterologist, and he was shocked that I'd been invited to discuss a paper that 10, 15 years ago wouldn't have been seen as appropriate for a clinical science symposia in an international oncology conference. So I am very impressed that ASCO has made a very intentional strategy to include that in the research component and in the overall strategies and needs for what ASCO focuses on. And then on top of that, they've created opportunities like when we were in person, the Women's Networking Center that has now become more of a task force. We have all of these equity initiatives that ASCO is really focusing on. So I was very impressed. I've been very impressed with how they've handled these challenges over the last couple of years. That being said, there is still a long way to go. We're talking a lot about the problems that exist. And again, those who know me know I'm all about talking about solutions and what we need to do to actually make changes. So I'm hopeful that as we continue to move forward, ASCO will continue to be a front runner amongst these national organizations, trying to not only talk about the issues that exist, but also really coming up with the solutions that need to be implemented in order for us to achieve equity.
Yeah.
Yeah, you're absolutely right. I think the oncology community, I think bolstered by the professional societies, can really be at the forefront of change. And perhaps the first thing to do is to talk about it. And I'm glad that the conversations are occurring. You do a lot of work in this area. It's something that you're passionate about, and you founded the Women in Medicine Summit. So before we turn to other topics, I would really like to know about what was the vision and what do you wish to do with it in the future?
So I actually founded the summit a few years ago after I have 3 children. My oldest is 7 and my youngest are twins who are 3. And I realized when I was out on maternity leave with my twins that a lot of the challenges that I had faced in my career and in my training, a lot of other women had faced as well. And I had always assumed that the challenges I had faced were because I wasn't good enough and because I hadn't done enough and I wasn't working hard enough. And then I was talking to these other women, some in leadership, some who were at my level, some who were still training. And the stories sounded so similar. And I thought to myself, how am I, an accomplished oncologist who had no idea that this entire space existed? Like, my dad is a surgeon, and I grew up thinking that we all were treated equitably. We're all doctors. We're all in the same training programs. I just assumed, maybe naively, that we were all being treated the same. And then when I discovered that women were getting paid less, when I started to look more into it and talk to more women and realized that women weren't getting promoted as often, in my mind, like my mind was blown. And I actually went to Dr. Julie Silver's conference at Harvard to do some leadership training for myself. And I met so many amazing women there. And I realized that these problems were pervasive and they were due to structural inequities that existed. And living in Chicago, I said, well, I live in a city and a state that has so many amazing institutions, academic and community institutions. Why are we not a hub for gender equity work? Why do we not have people here who are nationally renowned doing this work and creating these networks and these forums for women to come together? And so I decided that I was going to put together a conference. My dad had put together a conference for surgical societies. And so I asked him, how hard is it to put together the conference? And he was like, oh, it's easy. I'll help you. He probably thought I wanted to do like a 25 to 50 person conference. And then when it expanded to like 450 people, he said, well, this is a bit more than I thought you were going to do. And so I started with this small idea to kind of bring women together, and it's now blossomed into a really large national and in some cases international community where we provide education and leadership training. But more than that, we provide networks and community, and we provide toolkits and solutions and ways for people to really take what they learn at the conference and with the other programming that we do back to their own institutions and organizations and say, these are the structural inequities that exist. Here are some potential solutions. How can we actually move the needle forward? In medicine, we're really siloed, and there were so many amazing initiatives happening around the country. I was really frustrated because I realized I didn't know all of these initiatives that were happening. If I'm somebody who is interested in the topic and I don't even know all these things that are happening, how are people who are interested but don't have the time to spend to look into these things, how are they going to get plugged in? So my vision was to create a conference and a community that allowed anybody who was interested in really working on this issue and working on this topic to come together and have a place where they can say, I'm interested in doing research, or I'm interested in working on the promotion strategy in my institution. And WIMS would be a place where people could find those resources or connect with the people who might be able to help them get the resources and the guidance that they need.
Please forgive my ignorance. I don't know, but I presume that it originated as a local geographic, people come to this event. And then, of course, we had the pandemic, and everything that was once planned as an in-person event turned into virtual or was canceled. And that applied to ASCO and AACR and ESMO and many, many other professional gatherings. What do you see after more than a year of transitioning to online events, and you having 3 kids who are younger? I think that there are some good aspects and some less good aspects. It's not the same as being there. But on the other hand, you don't have to travel and be a part. Now, you are in Chicago. It's a little different, but I presume your reach, you would like to be very far beyond Chicago. And so what do you envision as the right balance for people to have a life and not have to get on a plane necessarily versus being able to interact in the same room together?
So I will tell you, it is a real challenge, especially with my 3 young kids at home. When it comes to virtual conferences, I definitely think there's a plus. So one, the big plus is it's more accessible. You can reach a larger audience. And I think the really big thing that we offered at WIMS last year and ASCO has offered the last year and this year is having it accessible for a year. So people can actually access the content for a full year after the conference. To me, that's really great because you can actually watch it at your leisure. You can watch it when your leisure, whatever time that may be, whether that's like 1 a.m. But you can actually watch it when you have some time to actually focus, sit down and watch the content. I think that is really, really a big benefit of the virtual space, where people who can't necessarily fly there and make it will be able to still access this important content. Now, on the flip side, for example, ASCO this year and last year, to be perfectly honest, I didn't block off the time because I couldn't really justify to my kids and my husband, I'm attending a virtual conference. Don't bother me for the next 3 days. I'm going to hole myself up in our office, which is really our bedroom, and watch, lectures for the next 3 days, because my kids don't understand that. When I'm physically home, they still get hurt. They still need food. They need somebody to take care of them. So the challenge this year for ASCO, to be honest, I wasn't able to watch a lot of the sessions live. I've been catching up now when I have time to watch the sessions now. So I think that, and there's also obviously the networking and the camaraderie and meeting up with people and those personal connections as well. It's obviously, I love seeing the two of you on Zoom, and we wouldn't have probably considered doing this a couple of years ago, but now the fact that more and more our social interactions with our colleagues are happening online, they're good in that they allow us to be more connected, but nothing can really change or improve upon sitting across from somebody, having a cup of coffee, giving somebody a hug, and having that personal connection where, if you're talking to them and you're looking them in the eye, they're not looking at somebody else on the Zoom screen. They're actually looking at you. So I definitely think that there's pluses to the virtual space and that you can make it more accessible to more people, but there's definitely challenges that come along with it as well, especially if you're juggling other responsibilities when you're trying to attend a conference.
Yeah. So, based on how last year's conference went, where I hadn't blocked off time to really attend ASCO. And, the format was a little different last year, where all of the sessions were available on Friday morning, and then people were just scrambling to sort of attend this or that. I think I tended to follow the sessions a little bit more closely because I knew when sessions of my interest were going to be live broadcast. So I think I was able to sort of block off that time. But I have to admit that virtual conferences have led to innovation. Jack and I were able to successfully intervene live meetings with, either Clubhouse discussions or Twitter Spaces conversation. We got a lot of engagement, which, I don't think we could have had engagement with 200 people simultaneously right after ASCO, oral sessions, which I thought was really neat. And, we don't have to be in the same room to have these really nice discussions, and people are joining in and dropping off. And it was almost like a happy hour where you're talking about science. So I did think that was a plus point, but I completely agree with you, Shikha, that, I was just sharing with Jack that during one of our calls, I did have a hurt child in the background. I don't think anyone really picked up on it, but there was definitely crying and screaming in the background as we were trying to discuss oral abstracts. So I completely get that. And I hope some component of a virtual space will exist in the future, and maybe will carry these lessons of innovative means of connecting with each other into the future.
And I think it's interesting having life intervene a little bit, just hearing the hint of kids in the background, or having to apologize for some of these that, my dog has a squeaky toy, and you're not usually contending with those kind of things, but we bond in a certain way, and it's interesting getting another dimension of each other, the personal side too.
Yeah. And I will say, when I was giving my discussant lecture, which I think if anyone watched it, I talked so fast because I was worried that I was going to run over time. And I was trying to get myself within the time period that my children would not start screaming in the background. My daughter decided that was the perfect time to start practicing her violin. And so if you hear any squeaky violin music in the background of my discussant section, it's because my daughter decided that was the moment for the first time in a year that she wanted to practice her violin. So,
well, you'll go back and someday hear that, and it'll be an endearing little connection. But I'd like to get a sense. You talked about the gender-based challenges of promotion and pay, and what are you getting a sense of in the wake of pandemic that now after a year, in terms of women bearing more of the responsibility for kids at home and kids who couldn't go to school, is this a major setback in academic medicine, academic oncology, specifically for women? Or are there some, maybe many women who are inclined to avail themselves of a decreased stigma of working from home, working from anywhere?
So I think a lot of it really depends on how we emerge from this pandemic, because there is no doubt that this pandemic has been really detrimental for gender equity work. We were starting to get some momentum, and I feel like we were starting to move the needle and move forward. And then the pandemic hit, and we saw a huge drop off in first author contributions and any contributions to journals by women. We know that when you talk about tenure clock extensions, men tend to benefit more from those than women. There were a lot of assistance programs put in place during the pandemic that I'm hearing are now being removed, where there was childcare assistance or there was more understanding. And now all of a sudden it feels like a lot of people are falling back into the old habits of, oh, well, tough luck, your kid is sick. Figure it out or you're going to miss out on this opportunity. And I've talked to a lot of parents, both men and women, who are struggling because their kids' sports schedules are back in full time, but they are now working hybrid. So sometimes they're at work, sometimes they're at home. So they're trying to balance this new world where some of their family is hybrid, some of their family is still virtual, some of their family is completely back to work or school. And there really doesn't seem to be as much understanding or grace as there was a year ago. So it almost feels like we took these steps back in gender equity. We tried to make some solutions during this time. And now the people who are in charge seem to be thinking, well, we're going back to normal. We should go back to the way it was, instead of learning from these inequities that have really been laid bare over the last year. We've seen more women leave the workforce than men. The amount of the inequities that we're seeing, it's really become almost comical when you read it. It almost seems like a parody when you see all of these drastic differences between men and women and in their careers. And the hope was that leadership would realize this is a problem, and some of the solutions that they came up with this year would be carried over. But the concern I'm hearing from a lot of women is that that is not happening. And so the onus is really on leadership. And we really need a top-down type strategy where we realize that these challenges existed pre-pandemic. They just became more obvious during the pandemic because we were almost in a stress test. And now that we're emerging from the pandemic, we need to realize that these issues have been there for years and years and years. We need to adapt to the fact that we have over 50% of women matriculating into medical school. We need to adapt to the fact that the predominant healthcare workers are women. And we need to start realizing that women have different needs when it comes to how they can equitably be promoted, and how we can make sure and ensure that this leaky pipeline gets plugged up very quickly by utilizing solutions that were brainstormed for the pandemic, but really should become the norm of healthcare and how we manage our healthcare teams.
Yeah, I'm just thinking of telemedicine is also one of those things that, there was always the potential for it. It was extremely underutilized, but even if it's not the right thing for every setting, was a great help in March, April, May of last year, and has gradually pruned down as that balance has been adjusted because of vaccinations and the diminished threat. But it is still a really useful tool that we have as a proof of principle works. The world still turns on its axis. And for many patients, it's a big help if you're doing well on an ongoing therapy and it's a challenge to take off a lot of time from work and drive an hour to the cancer center. It's a great tool for the job, even if it's not for everybody. And yet now we're seeing the payments from insurers roll back, and we're seeing the laws regress. And it sounds exactly like what you're saying. Like, we didn't learn from this, even though it really should have taught us a lot of what could make things better sustainably, but we accept it as only a short-term Band-Aid solution.
Yeah, it feels like we saw a wound and we put a Band-Aid on it. And now that it seems like maybe the wound has stopped bleeding, instead of putting more Band-Aids or adding stitches or making sure it's a problem that we take care of and we heal it, we're taking the Band-Aid off and saying, well, if you start bleeding again, oh, well, we fixed it, but when it was really needed. So it really seems like we're at a point where we should take the lessons learned from the last year and apply them to what becomes the norm in healthcare. And it feels like that's not happening. That being said, there are leaders who are realizing this and are trying to implement these solutions. But the excellent example you gave is telehealth. The fact that telehealth might not be reimbursed moving forward, to me, that is bonkers. I have so many patients who it would be beneficial for. It just doesn't make sense that that's something that we would not continue to provide for our patients. And also, when you talk about, work-life, I don't want to say work-life balance because that doesn't exist, but allowing for telehealth visits also allows physicians to sometimes provide more exceptional care without adding that added stress of being on this every 15 minutes. You have to go from room to room to room. And then sometimes patients are late because of travel issues. There's so many things that we really need to look at intentionally over the last year and figure out how to make these solutions long lasting.
Oh, I completely agree. I think telehealth clinics run so much more efficiently because usually the doctor is on time and patient is on time, and there's no delays usually. I want to turn a little bit to this topic of sexual harassment and, the abstract by Dr. Ishwarya Subbiah and colleagues at ASCO. This came on the heels of the Cancer letter regarding sexual harassment in oncology. And, while it's really gratifying to see that this is being recognized, I think to our point earlier about, I'm glad that the conversations are occurring at national forums and national meetings. But a part of me still feels very discouraged, especially when I talk to my colleagues and they tell me that this has been going on for years or this had been going on for years and many leaders knew about it and nothing was done. What's your feeling about this? Do you think we're going to get to a point where this is truly going to be a turning point or a Me Too movement in oncology? Or do you think this is probably not going to change as much despite the conversations occurring?
So I told you I'm an eternal optimist. So I like to think that this is going to be a turning point. But this has been present and prevalent in medicine since the beginning of medicine, since doctors and nurses and healthcare workers and hospitals. I think this has been pervasive in society for as long as society has existed. The question is the healthcare system, are the institutions ready to start taking accountability when these types of things happen? When sexual harassment or any type of bullying or harassment happens, there is a culture in medicine of passing the trash, as people say, or passing the buck, and it was described extremely well in that Cancer letter investigative report, where a very prominent oncologist was engaging in inappropriate sexual behavior with multiple individuals. And despite the fact it was well reported, well documented, and despite the fact that he even eventually admitted to some of these inappropriate behaviors, he still managed to continue to climb the ladder to leadership, be appointed to committees, get leadership opportunities. He was still speaking at national and international conferences and continued to climb the ladder of success. While I'm sure the women who he impacted either had some derailments in their career, they had barriers they faced, they probably met some challenges, major challenges that might have significantly impacted their career trajectories just for coming forward and addressing this issue or bringing this issue to light. And this is something that has been present for years. So until institutions start taking responsibility and accountability for this, I think we're going to be stuck in the same endless cycle. The comment that I made after this whole investigative report came out is, this is one story. How many hundreds, probably thousands of stories that are similar to this are out there that haven't been reported? I know if you talk to any woman in medicine, they will share multiple, if not more than dozens to hundreds of accounts where this has happened to them, whether it's sexual harassment or bullying. I mean, I'm sure, Charu, you and I could probably fill an entire day of podcasts talking about things that have happened to either us or to our colleagues or to our mentees. So this is not an isolated incident. I think that the way that we move forward is, again, we realize this is an issue, and it's not just a individual issue. What he did was absolutely wrong. And what men who participate and who engage in this type of behavior, what they're doing is absolutely wrong. I'm not saying they should not be held accountable. What I'm saying is they should be held accountable at the highest level of leadership. When things like these come out, people need to be held accountable, and they shouldn't just be swept under the rug and moved to the next institution. There was another, actually earlier this summer, a couple of months ago, in the middle of the pandemic, there was another very big similar story that came out about the TikTok doc, where at OHSU, he was a resident, and there were all of these different there were allegations that were put out that were actually proven to be correct. And then he was just transferred to another institution as well. So these are just two examples of big name individuals who this happened to. And the women who came forward are obviously extremely brave. And my hat's off to them for taking that to the next level and taking it to their leadership. But the thing that concerns me so much is that how many times did they have to bring it to leadership where it was ignored or passed over, or his contract wasn't renewed and he left to another leadership opportunity at another academic institution? So to me, to answer your question, do I think this is going to be a turning point? I don't know. I hope it is. I really hope that these two, and I'm sure there's other stories that will come out in the next couple of months to years. I hope that these types of stories really make the leadership and institutions take a look internally and come up with really good ways that women or men, really anybody who comes and reports these types of things, know that their voice is being heard and know that these allegations are going to be looked into. And then not only that they're going to be looked into, because we don't just want to hear, yes, thank you for sharing, we'll take care of it. There should be actual tangible repercussions that happen when this type of inappropriate behavior happens. And I think that's the point that's missing. A lot of institutions say, oh, we have a diversity council, we have an ombudsperson, we have HR, we have mentors, we have people you can go to. But then after you report the incident, there's nothing that happens afterwards. That's the concern. I think a lot of times the person who is the accuser is offered counseling. They're offered, how can we help you? What can we do to help you? But in actuality, if the person who has actually engaged in this bad behavior isn't reprimanded, or if there aren't any consequences for him, there's no reason for them to stop doing what they're doing. And so I really think that there is a possibility that we can make a real difference and we can change the way that these things are addressed at an institutional level. But it's going to require leadership to be intentional in what the strategies are for the next step after these types of allegations come to light. And those next steps have to come with repercussions if the allegations are proven to be true.
But, I think it's interesting. It's challenging. It's not, obviously it's not just the most egregious cases that are really the problem. I mean, when Aishwarya Subbiah reports that 70% of women have experienced some form of harassment, that's not, I hope, and I don't believe, often that as obvious, as severe as that. And it's not a tiny percent of men who are doing this, and sometimes women. Instead, it's a pervasive culture. It's a lot of little events, just like, George Floyd is not the sum total of racism. It's a ton of policies and systemic processes. And anyway, I think that just makes it all the more challenging. It's a slow process. I do not think that this turns on one or two key events and consequences for people. It takes decades to change views, although, and I don't I don't always consider myself as much of an optimist as you do. I would say that, things are unquestionably better than they have been in terms of racism and sexism and homophobia, things that were just not even considered because they were so taken for granted. And it starts, I think, by measuring and talking about them. And so I think that is an important step for where we are now, is not just the high profile events, but the pervasiveness of microaggressions and all those issues. It's never going to get tackled until we acknowledge this stuff out in the open. And I think a next step is what are institutions going to do about it besides circling the wagons and protecting their brand?
Exactly. And I will say I 100% agree with you. And I actually find it so fascinating that when I was a med student and a resident and a fellow, I didn't get training or education in this type of topic. So I think we are at a point in our history right now where, in the medical history at least, where we have addressed the fact that this is a problem. And not only have we addressed that it's a problem, we're now educating others to make sure everyone knows this is a problem. And I think culture change happens by addressing the fact that something is a problem and then moving towards the solutions. And you're absolutely right. It's a cultural issue. It's pervasive throughout healthcare. And these big name events that happen that get investigative reports in the cancer letter, those are just the tip of the iceberg. And so I think the fact that we are talking about it and we're educating our students and our trainees and our CEOs, I mean, we're educating everybody at every level in the healthcare system about these topics and these microaggressions and implicit bias. And we're incorporating it into leadership training. We're incorporating it into med school curriculum. I think the fact that we are at a point now where we've addressed that it's a problem within healthcare. Now, the next part is, all right, how do we change the culture? Because things that were said to me and done to me and, things that I experienced and my colleagues and friends experienced in residency, if those things happen now, I can guarantee my trainees would not stand for it. And they would be coming to me or someone else and saying, this person said this, what are you going to do about it? Which 10, 15 years ago would not have happened. I mean, you just live through your residency, you do the best you can, and you don't worry about these implicit biases and microaggressions and people making lewd or inappropriate comments. But now the culture has changed. So I absolutely agree with you, Jack. We're definitely at a point where things are getting better because we're addressing and identifying the issues. The next step is coming up with solutions for how do we really implement solutions to change the culture so that even those events that happen now, they don't happen.
Well,
I agree.
Go ahead.
I agree. And I just want to amplify this one point that I think education is so important. So while we may be aware that these, microaggressions or actually sexual harassment is occurring in 70% of women in oncology and men, actually. I feel that there is this educational gap that exists in professionals who may have gone through training 10 or 20 years ahead of us, right? And I'm still floored at some of the responses. If an accuser goes to a superior and says, this actually happened to me, some of the responses are you sure that's what happened? So I think this is the education gap that we need to fill with people who may be 10 or 20 years ahead of us, who may be in leadership positions right now, to say, you need to open your eyes to see that this is actually happening. So don't question the accuser and have an open mind and listen to the whole thing, investigate it. Don't dismiss it as, no, I'm sure he didn't really actually mean that, or maybe you're just hearing something else, and let's not make a big deal about it. So I do think that, yes, having a conversation about this is important, but also the education or awareness that this is actually occurring and informing people that this is occurring is so important.
And I think it's also important to remember, as Jack said earlier, the bullying and the harassment, a lot of it is microaggressions, but some of it are things that women don't even know are happening. And when they happen, for example, I've heard of women who've had smear campaigns run against them at their own institution, and they believe the man who's been there for 20 years because he doesn't want to work with a woman who might be more opinionated than he's used to. And so I think that there's so many different components that contribute to this harassment and to this bullying and sexual harassment. And because it's become such an accepted part of medical culture, I think we really need to be intentional in figuring out how do we change the culture. And the way we change it, again, is education. And you're absolutely right, Charu. We need to be educating people from the top down, because when I tell stories to people who are in leadership and I say, this happened to me or this happened to a colleague, despite the fact that I'm considered an expert in the field, they literally say to me, no, there's no way that happened in 2021. And I say, no, I was in the room when it happened. I know that it happened. And they can't believe that, one, these things are happening, and two, that when they happen, that nothing is being done about it. So I think you're absolutely right. The education needs to go from the top down.
But I would also say it shouldn't be surprising, or I would even say disheartening, that people are going to need to be bashed over the head with some of this a lot. I mean, it took decades to address smoking cessation. It's not that the data weren't there. It's just it had to counter campaigns that were well entrenched. And of course, racism and sexism and homophobia are not gone, but they're a lot better than they were in the 60s or 70s or even 80s and beyond. But, we are still in 2021 discussing and having painful issues around systemic institutional racism, things like that. And yes, people are going to think that these most extreme cases are outliers. And I think that people who have grown up with the system are going to be complacent about it and need to see not just what you and the people who speak about in the cancer letter, these cases, but the 70% that it's happening all day long, all the time. And they're going to need to hear it from multiple sources over and over. And it's not going to change in 2021, but you are not going to get to where you want to be in 2024 or 2030 without making people far more receptive quite gradually. And I don't have an easy fix to that. I just think you have to. It's like eating an elephant. You have to do it one bite at a time. It's a very gradual process to change culture, but it is, I think, happening. And I don't want to be a Pollyanna about it, but that my sense is it's being talked about, and it's not just being talked about by a few people who are considered shrill, outliers, but rather now there's buy-in by professional societies like ASCO, and even if institutions don't want to talk about it, they're being shamed into doing it. And these are important steps.
Well, and I will say one thing that we always talk about at the Women in Medicine Summit is change isn't going to happen if women are the only ones making the change, right? So a lot of times women aren't in those leadership rooms or they're not at the table. And so it was almost becoming like an echo chamber where women were talking about this, and there were a couple of dabble of men who were saying, yes, this is important, but there wasn't this feeling of everyone should be doing this together. And, I say this because I think a lot of people don't realize that when it comes to gender equity in the workforce, that actually directly translates to better patient care and better outcomes. So you want to make sure that you have equities within your physicians and with your healthcare workforce, because that directly translates to better overall care. So one thing that we've done with the summit is we've actually launched this longitudinal leadership program for men. And we call it our Inclusive Leadership Lab. And it's literally a longitudinal leadership program dedicated to male leaders. And we had our first cohort that's ongoing right now. And male leaders join once a month for this longitudinal leadership program where they're learning how to be more inclusive leaders. Because there is a difference between being somebody who gives lip service and, appoints one woman to a board and says, yay, I'm a gender equity advocate, I did my job. And the person who brings and identifies the appropriate and most appropriate candidates to the job, men and women, and intentionally creates an inclusive leadership environment. So I think it's important to note that when you're doing this type of work, you need to have both men and women at the table in order for things to move forward. Otherwise, we're just going to be in an echo chamber complaining about how this is a problem, and we're not going to implement solutions.
Yeah, and I agree that, it's nothing like having someone who's been a longtime beneficiary of the system saying this is not an equitable system.
Well, this was a wonderful conversation, Shikha. Thank you so much for joining us today. You can find us on iTunes or wherever you find your podcast content. We hope that you will subscribe and send us comments and feedback to beyondthejournalshow@gmail.com. We would like to thank Mark Lindsay and Talking Speaker for production and distribution support. See you in a couple of weeks with our next guest. Thank you.
It's great talking to you. Thanks so much.
Thanks so much for having me.